So what is the difference between a porcelain crown and a porcelain veneer? I suppose there's a lot of misconception with this concept between a porcelain crown and a porcelain veneer, and I suppose many people think that it's much easier to have a porcelain crown. They also think that there may be more preparation or more tooth removal or removing parts of the teeth when actually doing a porcelain crown over doing a porcelain veneer. I just want to explain what the differences are. If you have a tooth and you've lost maybe 50 or 60% of the tooth due to decay or a big filling, usually there's not enough natural tooth to place another filling, and that's when we normally use a porcelain crown. A porcelain crown actually replaces all of the enamel, so it's like replacing the shield. We know the enamel is the strongest substance in our body, and we know that once that enamel is damaged or lost, it means that you're into the softer part of the tooth and there's more chance of the tooth breaking or losing the tooth. So when we do a crown, we do have to remove at least 1 mm to 2 mm of the entire tooth or the surface of the tooth in order to replace it with porcelain, so that porcelain becomes the new tooth enamel. So what happens if someone comes in for cosmetic treatment but their teeth are actually sound? Maybe they're just slightly misshaped, or the colour's not right, or they're in the wrong position. When we do porcelain veneers, we're only changing the very surface of the tooth. And nowadays with technology, we can get porcelain down to around about 0.1 of a mil. It's very, very thin. So the idea then is to be as conservative as possible and remove the most minimal amount of tooth to get the best cosmetic result. There's also new concepts called contact lenses, where they're actually very, very small pieces of porcelain. So someone that's got extremely sound teeth, where they may have spaces or gaps, and they want some minor changes to the tooth, they sometimes want the most minimal preparation possible, or no preparation. And what we can do is either minimal preparation veneers, which are ultra thin veneers, or these contact lens pieces of porcelain to actually change the shape, position, or color of the tooth. The thing you have to remember is people will say, well, because they're smaller pieces of porcelain, is the price going to be less? It's actually harder for us to do things like contact lenses and veneers over crowns because they're very difficult to actually handle, and because small pieces of porcelain are much harder to actually mask defects with teeth. It means that it's much more difficult for the dentist and the technician to actually create these small pieces of porcelain.